Kathy, I will turn it over to you to lead us in this very interactive Zoom meeting. And again, thank you everyone for participating.
Thank you, Sylvie. Thank you, everyone, for taking the time to join us today on this first Indiana statewide Policy Circle call. As Sylvie mentioned, we own and operate at the moment 3 small companies, all of which have been hugely impacted, as many companies have around the country, by the coronavirus. One of them, I want to give you a little taste of what's going on. One of them is called Escape Camper Vans, and we rent camper vans all around the US and Canada. Half of our customers are from Europe. Of course, they're not coming. The other half are from the US who can't fly. So we've had to cut our workforce from 69 people to 6. Many of these people go to national parks, and of course, many of them are closed. We don't expect any business in April and May. And what's been remarkable is just seeing our own employees say, we're going to hang in there. We know that, we're going to be rehired back. And of course, we have some amazing, loyal people around the country that we look forward to getting back into our business when this changes. A second company manufactures women's apparel. Obviously, women's apparel right now, brick and mortar stores, both department stores and boutiques, are all suffering. So that's impacted our business. And lastly, we have a company that makes drinkware that is sold to a lot of events. So events and festivals have all been canceled. So, it's a huge issue right now. We know we're going to get through this. It's always remarkable to see our employees and how incredibly loyal and supportive they are. So obviously, one of the biggest sectors affected in this coronavirus are our restaurants. And I'd like to turn it over to Martha Hoover. Martha is a former sex crimes prosecutor turned restaurant owner. And she, as many of you know, in Indiana, has created a really amazing collection of restaurants, from Cafe Patachou to Patachou to Napoli's and Public Green's Urban Kitchen. I'd want you to know she's a 5-time semifinalist for the James Beard Outstanding Restaurateur Award. And she's also created the Patachou Foundation, which provides healthy meals to low-income people. Martha, would you please share with us the impact it's had and how you've addressed this crisis in your business?
Before we get to Martha, I did want to let everybody know that Congresswoman Brooks is on the line, and I know that she has a very tight time frame. So hey. Congresswoman, we're gonna go ahead and unmute you so you can get back to the people's business.
I'm so glad, Susan, that you're able to join us. Just for everybody, I want them to know that she represents the 5th District of Indiana, and she was a former deputy mayor of Indianapolis and a U.S. attorney. And thank you so much, Susan, for hopping on and helping us. We'd love to know from you a little bit about what you think are the most important highlights of this bill that will get America back to building a better economy again, and what you feel are the most critical things that are in this bill.
Thank you, everybody. I am coming to you from Washington, D.C. I'm about ready to speak on behalf of this bill, and thank you, Kathy, for having me be a part of this. I had hoped I wouldn't have to come back, but unfortunately, we did all have to come back. This is a historic piece of legislation, the CARES Act. Some of the most important pieces, and by the way, I do have gloves on, and we are all social distancing in the chamber. And it's actually quite tense in the chamber, but it's also quite hope-filled. We are really coming together in a significant way. $350 billion is being created under the CARES Act, and that is called the Payment Protection Act. It's to bring people's pay back, Paycheck Protection Act, I'm sorry, the Paycheck Protection Program. And it is going to allow businesses to go to their banks and credit unions and take out loans, many of which could be forgiven, to make payroll. It's all about making payroll. Now, the guidelines for how to get those loans have not been issued yet, but I would strongly encourage people to talk to their banks and or credit unions about payroll, about rent or mortgages, about expenses that they need to run the business and keep the business going, even though the business might be closed. Also, we are adding significant funding to the unemployment insurance program for the state. So in addition to our state's own unemployment insurance program, individuals who make under $75,000 a year will get up to $600 a week additionally in their unemployment benefits. And we also, and so that too will be stood up in the next couple of weeks. And I know every day is critical. And then finally, there will be a rebate program for individuals to receive up to $1,200 check from the government to help them get through, and up to $500 for their children. Now, I am doing this at a very high level, and there are so many more things in this very important bill also to make sure there is more funding, most importantly right now, to purchase supplies and to help our medical workers who are on the front lines, and to try to make sure that our hospitals and our health clinics and all of those folks have the funding they need to stay open, to treat patients. Indiana is not nearly at the point where New York and New Orleans and some other cities are, but our numbers are dramatically increasing. And so we have to try to make sure that those critical healthcare workers and first responders are protected. And so it is to provide more funding to make sure our hospitals can keep their doors open, can keep ordering supplies. So that's a very high level. It's a very, it's a historic landmark piece of legislation. I'm going to encourage my colleagues. I'm getting ready to go out on the floor and speak, actually along with your good friend Elise Stefanik from New York. We are two of the last speakers who will be speaking. She said to say hello, but a number of Hoosier members have been speaking on the floor. Not everyone could get here. We learned late last night, late yesterday afternoon, that we really needed to be here. I got on a plane last night. Indianapolis Airport was empty. Reagan National was empty. There were 3 passengers on my flight. I've never seen anything like it. But on a positive note, I asked my cab driver, and yes, I did take a cab. I was his only customer. He had sat for 8 hours at the airport waiting for a rider. I was his only customer. And so we took an extra long ride, and I actually had him drive and show me the cherry blossoms. So we didn't go directly to my little place, but the cherry blossoms were beautiful. It's a beautiful day out here, and I'm really hopeful that we can pass this bill. The president, we know, is standing ready to sign it into law and to get, you know, the wheels of government churning as fast as possible to heal our country. And so I want to thank everybody who's participating. I want to thank you for your support and for the important work that the policy circles do for our country. We will get through this. We will. I hope it can be faster rather than longer, but we all have to do what we can to heed the message of social distancing, of helping make sure that our elderly and the most vulnerable are protected. So thank you. And I'm sorry, I really don't have time for questions.
I know, but we appreciate
back to the floor.
Thank you so much, Susan. We really appreciate your making the time to talk to us. And of course, get out there and speak and get that vote going.
Okay.
Say hi to Elise.
Thank you. God bless our country. And
oh, yes. Thank you so much for your service and your leadership. Thank you. Bye-bye. Well, that's great that we had a chance to hear from Susan.
Yeah, great from the floor. You know what, Kathy, just before you go on, I'd like to just leave the floor to Judy to kind of introduce a little bit the mechanics of Zoom. If people want to ask questions, I missed doing that at the beginning. I apologize. Judy, sorry about that. You should have chimed right in. So Judy, can you just tell our participants, you know, how they could raise their hand if they want to make a comment next, and how you're going to call on them?
Sure. Yeah. Well, I was going to interrupt at some point in time because I was like, there's not going to be any hands up. So thank you for joining us. We are recording this conversation. If you would like to turn your camera off, just scroll to the bottom of your screen and click the camera icon. Please turn off your notifications on your phone and your computer by accessing your network preferences or settings. You are all currently muted, so if you would like to participate during the, when we open it up, you will have to notify me. And if you join by computer, you will simply scroll to the bottom of your screen until you see the word participants. Click on the word and a list of participants will appear on the right side of your screen. If you scroll over your name or phone number, you can access the drop-down menu and click on the raise hand button, and a little blue hand will appear next to your name to alert me that you would like to speak, and then I will unmute you and call you out by name. If you've joined by phone, you can push *9 and you will hear a prompt telling you that the host has been notified that you would like to ask a question. And then I will unmute you and you will hear another prompt telling you that you have been unmuted. So if you are on computer and you would like to chat with me using the chat bubble located at the bottom of the screen near the participants button, feel free to chat with me. And lastly, in accordance with the Policy Circle Roundtable discussion model, we've assigned a note taker who will be posting a recap, and we have a timekeeper who is me, so I will interrupt you if you're going too long. And Sylvie will be the facilitator. Kathy today is going to be the facilitator guiding us through the Socratic learning method. And finally, we just read the guidelines for civility in our conversations. So let's be open and curious. Everyone has a unique perspective. Be prepared to hear a different point of view. Listen first and focus on the facts. Be respectful and engaged, be focused and concise, keep the conversation centered on the issue and on the brief. So those are the housekeeping. Kathy, now it's your turn.
Okay, thank you so much, Judy. Okay, so I was giving the introduction to Martha Hoover, and I'd like to go back. I finished with saying about that she has created the Patachou Foundation to provide healthy meals to low-income and insecure children in Indianapolis. So let's go back to Martha to hear about her story of how this virus has affected her business and what they have done to deal with it, both from an economic standpoint and also from helping people. Thank you, Martha.
Well, thank you. Thank you, everybody, for having me. And I'll try to keep my perspective concise and brief. Segueing from what Susan Brooks just said, talking about taking a taxi in from Reagan, I think I need to put the magnitude of the impact that the restaurant industry has felt in comparison to some other industries. I did some research last night getting prepared for this meeting, and it just so happens that the taxi industry was something I looked into. If you take the taxi industry, the public transportation industry, pro sports, cruise lines, airlines, and hotels together, it's about a $590 billion a year industries combined. The restaurant industry on its own is a $864 billion industry.
Wow.
So by perspective, right? The differences are huge.
Huge.
Here's one way that I have explained it to people that I think makes critical sense to everybody. There are 5 or 6 national airline carriers. You could name them all. Everyone knows who they are. By comparison, there are 660,000 restaurant owners, 660,000 different restaurant locations. The restaurant industry employs more people than all those other industries I just mentioned: airline, public transportation, pro sports. Not only do we employ more people as an industry than those industries do individually, but also as they do combined. Everyone's very concerned about the airline industry, noticing that airlines, as Susan just said, had 3 passengers on board. The restaurant industry feeds more people on a daily basis under obviously normal circumstances than fly worldwide. The restaurant industry buys more products on a daily basis than all of the industries I mentioned combined purchase. So the magnitude of this, the this virus on restaurants really exceeds everyone's idea of what the restaurant industry is. Most people, when they think about the restaurant industry, they think about the 5 or 6 restaurants that they go to in their own cities. They think about famous restaurants in Paris, in New York, Chicago, wherever. And they think that the industry is not as significant as the numbers and data show. And I think that as a starting point is really necessary to have. Any questions regarding that?
We're going to open it up for questions.
Gotcha.
After
Robert,
everybody, after Robert speaks.
So
Keep going.
Patachou is obviously a very micro part of the entire restaurant industry ecosystem. And the ecosystem is extremely complicated, and because it's so complex and so historically complex, and it is very difficult to summarize all these problems that the restaurant industry is having. People have been hearing for a while about how restaurant workers are particularly vulnerable. And that is true. No one would deny that. Most restaurant workers enter the workforce unskilled. Most restaurant workers are hourly employees. 99.9% of restaurants offer no benefits to hourly employees, and nothing like PTO or sick days, nothing. So yes, restaurant workers are remarkably vulnerable. But I think what people are learning now is that the restaurants themselves, the entire industry is vulnerable. Without sales, without cash flow, restaurants, even the most profitable restaurants, including large publicly traded restaurants, are unable to proceed. And that's a critical issue. Danny Myers of Union Square Hospitality Group closed his restaurants down 4 days before we did. He did it, of course, there was a health aspect to it, but it was before anyone was mandating closes. He did it because this is in a podcast that I was listening to from him last night. He did it primarily because he could not afford to go on with the sinking, with what was happening with his sales. We are in the same position. We are no different than a McDonald's, a Waffle House, a Shake Shack. And we feel like Patachou has been an extremely stable, profitable company for a long time and been in business for 30 years. But without cash flow, without business, with our doors closed, we too are faced with a real imminent problem. And it would be the utmost arrogance for me to sit here and say, as successful as Patachou is, that we will easily weather this storm. On March 17th rather, 12 hours after the governor in Indiana mandated that restaurants close for dine-in, we laid off 275 of 315 workers. We have since continued to lay off workers. We are now in true skeletal mode. We provide a lot of resources for our workers, but what they really want, what they really need are jobs. And we can't provide jobs given the status of what's going on today. I probably had, within the first 4 hours after the governor's mandate, I probably had 20 people text me. I will note this, no offense to the men on this call, 19 of the 20 were men asking me if I had considered carry out and delivery. Yes, of course, we consider carry out and delivery. Emergency times are not really the best time to create new systems, and we're a very system and data focused company. So although we had carry out down, we did not have delivery. We do not offer delivery, and I made the choice to not extend in that space. It was something that I thought we would not be able to succeed at in a pivotal emergency moment. As of today, one of our 12 restaurants is offering carryout. It's our pizzeria at 49th and Pennsylvania, Napoli's. After service tonight, I am closing that down as well. And the reason I'm closing it down is a combination of financial and health reasons, but primarily I think it is unfair, as I am hunkered down at home, to ask any of my staff to come in, even those who are getting paid fully now. It's just not right to ask them to come in and put their own health and the health of their families at risk. So we are closing down after today's business. Something that my company has had in place for 6 years that I'm very proud of, and we have had a significant amount of restaurant colleagues from around the country contact us this week to ask for our language and how we did this, and to ask for advice on how to implement a program like ours, is we have what we call the PEER Fund, a Patachou Employee Emergency Relief Fund. This fund was created 6 years ago. It was seeded by the company. It's administered 100% by my staff. I have nothing to do with the administration of it. And it's exactly what the name indicates. People who work for the company who are at risk and having a financial emergency can apply to the fund, and the fund grants or gives money to employees to help them through these times of crisis. On Monday, we have taken all of our carryout and gift card and merchandise money that we've received and funneled it directly to our PEER Fund during this crisis. On Monday, we wrote over $40,000 worth of checks to people to cover the basics. We're talking about prioritizing rent, shelter, food, and medicine. Over $40,000 in a company that is really small. We're a small restaurant group. $40,000 to help those employees.
Yeah.
So
thank you for sharing that, Martha. I know there will be lots of questions in a little bit here. We'd like to move on to Rob Metcalf from Eli Lilly. Rob is currently the Vice President of the Clinical Development Organization at Eli Lilly and Company here in Indianapolis. And in this role, he's responsible for the worldwide delivery of clinical research across all therapeutic areas and phases of clinical development. He's also responsible for Lilly's biometrics and advanced analytics organization. Rob, maybe you could share with me how Lilly is involved in this effort and what the testing is that you are doing, and give us some of the facts about what's going on with Lilly in terms of dealing with this crisis.
Thank you, Kathy. It's really a pleasure to be here with this group. You know, early on, when we saw this healthcare crisis coming, we really wanted to focus on how we could best contribute to that. And you all know that Lilly has a long history of making medicines that help people, live longer, healthier, more active lives. But we also have a long history of contributing and helping out in the Indianapolis and Indiana community. And that was really our focus. When we started understanding what we could do, we felt that we had unique lab skills and capabilities in our organization that we could repurpose very quickly to help with testing. So we partnered early on with the Indiana State Department of Health and our specialized lab individuals to do two things. First of all, to be able to get our lab set up to be qualified and certified to do COVID-19 testing, which we did in record time. We did this in a matter of days, which usually takes months to stand up a lab basically from scratch and then get them qualified and certified. But our scientists work incredibly long and hard to be able to do this, and the state health authority was wonderful to work with in helping us get certified and established to be able to do this. Then we've been working with the state to be able to take samples from their program across the state of Indiana. And they have the criteria that they've been using that's in alignment with the president's criteria, and they've been working with hospitals across the state on how to get those samples identified and then routed to Lilly. And then Lilly has been testing those samples, and we've been providing those results back to the state health authority, who's then been making those available to the various hospital groups. The second opportunity that we saw, and a bit more focused on Indianapolis, was to be able to test individuals and to do that in a safe and effective manner. And we saw from what Korea was doing, for example, and what other jurisdictions were doing with drive-through testing, that that could be an opportunity for us also to contribute to the fight against this epidemic. So we marshaled, Lilly people always rise to a cause. We marshaled a number of volunteers, and very quickly, and with very little expertise in this, because we're now trying to deliver and support healthcare directly, we marshaled up Lilly resources to put a drive-through testing capability in place. And we first piloted that with Lilly employees because we needed to understand where issues and challenges were, having never done anything like this before. And then we expanded it starting last week to healthcare workers, because our belief is we need to protect those first and foremost and get them back to work, those who are looking after us. So that is physicians, technicians, other healthcare workers who are on the front lines battling this disease. The other area that we focused on is our first responders, those that protect us where we live and are vital to the infrastructure of our community. So our police, our ambulance service, others of those first responders that are critical to keeping us safe in the community. We have been working to scale up our capability. So we started off with a minimal capability to do testing and a minimal capability to be able to take drive-through testing. But as we've been learning every day and we've been improving how we do this, we've been able to increase our capacity. Now that capacity is always going to be limited. We have a finite capacity. We have challenges like everyone does in getting key essential equipment to be able to do this. PPE, you see that on the news every day. We need that for our workers to be able to, and our volunteers to be able to be safe in testing individuals. We need that for our lab individuals to be safe in managing this virus appropriately in the lab. And then there are other supplies that we need as well. So we've been trying to manage that and scale up our capability as we learn and as we are able to, given the supply situation. We recently, this morning, have expanded our offering to test first responders to Central Indiana. And we've been working with the mayor's office around this testing program, and we've been working with the state health authority in expanding that. So that's where Lilly is at right now. As we learn more and as we're able to increase our capacity, we hope to be able to do more broadly. But our first and foremost mission was to be able to bring this capability on board, which we did extremely quickly, both from a lab and from the drive-through testing approach that we've taken. And then to ensure that our healthcare workers who are on the front lines battling this horrendous epidemic, and then our first responders who protect us, we do our part to try and make sure that they're safe and they're able to work. So that's a quick summary of how we've approached it from Lilly's standpoint.
Thank you so much, Rob. That's very, very helpful. I'm sure that in our audience, we have a number of questions. We would like to open it up to the people on our call and see who might have questions to pose to our different speakers. And Judy, I'm going to turn it to you to help manage that.
Sure, wonderful. I would like to ask Amanda Muldoon what your perspective is what you just heard.
Terrific.
You're unmuted, Amanda.
Oh, okay. I'm like, oh, where's the mute? I was actually going to ask Martha a question. You know, she was mentioning putting these processes in place in this time of emergency, right? And not wanting to do that, and I completely understand that. And of course, you know, Holcomb ordered restaurants to close the doors, but had he not ordered that, at what point would those restaurant owners consider doing that themselves? And was that a consideration of yours? I guess, what are your feelings on that?
Hey, Amanda, how are you?
Hello.
Am I unmuted now?
Yes.
Okay, great.
You are.
So let me retract something that I said. We didn't want to put the process in place. We didn't want to take our resources to develop a process for delivery. We did, however, a week before the mandated, the mandate came down. The mandate was announced, the first mandate was announced on Monday, March 16th. The prior week, my executive team met in our weekly meeting, and our weekly meeting that week literally was the beginning of our war room on Corona. We're very lucky. One of the members of my executive team is in a postmaster's pre-doctorate program at Harvard on risk management. So we were able to tap into her knowledge, which, believe it or not, was extraordinarily helpful. We created 3 models, 3 plans as to what we would do, knowing at some point in time, even if there wasn't a mandate, we would probably choose to close. And that was based on the economics that we were faced with. The National Restaurant Association published a graph 4 or 5 days ago that showed the precipitous decline nationally in restaurant sales beginning March 1. And our company's sales mimicked that decline. We were not an outlier. There are very few outliers today in the restaurant industry of restaurants that are making money. None of them are. So we had plans in place as to how we would shut down. Shutting down a restaurant is very complicated. It's not like an office where you can grab your laptop, grab some files, and go home. Shutting down a restaurant for us is at least a 3-day process. And if I could just very quickly go through what that process is, just for illustration, we had to do food inventories, perishable inventories, shelf-stable inventories. We had to see what the shelf life is on every product. We had to take all the food out, all the chemicals out of our facilities, take everything to a central space where we reweighed, relogged, redated everything, distributed what we could. Then we had, at the same time, teams doing deep clean sanitation of all the facilities. Then we had to go in and inspect all the facilities. Then we had to turn off utilities, get in touch with landlords, with anyone who we had contracts with, who, as you all know, it's not just that we pay rent and that's all our obligations are legally. So it really took a playbook that we were creating on the fly. We're pretty pro at it now, but on the 16th, we were not. But we did put plans in place quickly, and we're able to shut down 11 restaurants and a production kitchen within a 3-day period of time, which I think is miraculous.
I must say that's an amazing feat in itself, and just so remarkable, your description of the huge impact that I wasn't aware of the huge impact that the restaurant business has on our total economy. I mean, worldwide, incredible. So back to you, Judy, on our next question.
Yep. We have a Margie McCormick. You are unmuted. We'd love to hear your perspective or your question.
Thank you, Judy. My question's for Martha. Martha, listening to Susan Brooks, I'm interested in, will the bill that she described, particularly I was surprised about the small business loans, will that be of help to you in a kind of unstable economy, you know, not knowing what your business might be like going forward? Seems to be getting more loans could be a little intimidating.
That's a really, really great question, and I do not have the answer. First off, we don't have a law yet, so I don't even know what's out there. I'm a member of several restaurant councils, James Beard, chef associations, and we're all diving deep to figure out the details. What has become apparent to us is that the push for financial aid for restaurants is getting unevenly distributed between restaurants that are large, what we call big food, restaurants with more than 500 people working for them. That's a lot of people in the restaurant world. And those restaurants, we fear, are going to get their disproportionate share of the aid. Patachou has systems in place. So we have we've hired a lawyer, we've hired benefits advisor to help us at this moment decipher what this bill will mean, what the potential law will mean specifically to our company. And hopefully we can take advantage, because it would be the lifeline. The real issue restaurants are having right now, one of the issues that this bill is not addressing, is that every restaurant in the world carries insurance, business insurance. And the insurance companies, we, for instance, have business interruption insurance, business disruption insurance. There is on page 75 of a 200-page document, a minor statement in everybody's contracts with their insurance company that says viruses and bacteria are exempt. So people in the restaurant industry have been paying millions of dollars. I can't even tell you how much. We pay hundreds of thousands of dollars a year for this insurance that the insurance companies are denying coverage on. And that, to me, is not only a disgrace, and we could talk about industries and what they're doing and what ones are rising to the occasion now, such as Lilly. But I imagine that that's going to end up in a very large class action lawsuit. And that is really a lifeline to many of us. Payroll, the bill covers payroll.
It does, right.
But it doesn't cover business interruption.
For those who'd like to have it, we are going to send you a 30-page summary of the bill, which we have available to anybody who would like to receive it. We'd like to, of course, some people want a summary of the summary, but that will be helpful. And I think what many businesses are finding is that, hey, if you don't have revenue, how do you even pay for your current loans, with your banker or whatever? So there's going to have to be that, like, you need almost a bridge loan kind of thing, but that's hopefully what's going to come out of this.
Kathy, we have only a few more minutes left, and Katie Glick has a question for Mr. Metcalf. So Katie,
Great.
you are on.
Thank you.
Hi, Rob, I don't know if you can speak specific. Hi, it's Katie and Vivian. I don't know if you can speak to this specifically, but can you talk a little bit about what the Lilly Endowment is doing? I mean, the company is very influential in the state, but so is the endowment. And I know there's been some announcements about them helping the community during this time.
Yeah, thank you, Katie. No, unfortunately, I can't. That's not my area of expertise. Okay. But, Lilly's endowment has a long history of helping the city and even the state in times of need. I can follow up and get the right contact information to Kathy and the group. I'll work with Leanne, Kathy, to do that and bring this question back.
May I ask a question of you, Rob?
And
that is relating to testing in general. A lot of people are thinking, should there be widespread testing among the entire population that would help people know, do they have it? Did they have it and didn't know? What do you, is that a valuable information as, in this whole, as we look at the whole country in terms of maybe could you ever get certain population back to work?
Kathy, the more that we can learn about the epidemiology of this disease and its spread, the better off we'll be being able to combat it. So as widespread as we can get testing to be able to do that is really should be one of our major goals and objectives. But unfortunately, you know, we're not in that position as a country, as a society at this point in time. I know that we're helping to rapidly contribute to the expansion of that. I've been in touch with many labs around the state and the country who are working diligently to do that. But that is really a key priority, and not just central lab testing, but get to point of care testing as well. And there's new technologies. Right. So all these strategies are critical to getting testing as widespread as possible so that we can really understand and then therefore effectively combat the spread and etiology of this disease. You know, in healthcare, as I've spoken with people, they have one goal and one goal only: to flatten the spread of this horrendous disease.
Right. The remarkable thing about what's happened in this is that, you know, we've been looking at antivirals coming on the market faster. Everything has worked faster than it has with previous situations. So maybe that'll be good for our overall health as in the world, you know.
You know, I think that there will be a lot of wonderful learnings that we'll be able to apply to this. You know, there's light at the end of the tunnel.
Yes, I agree. Judy, do we have some more questions pending?
Sylvie Legier would like to ask a question for Rob. Sylvie, you're unmuted.
Great, thank you. Rob, you know, on testing, thank you for sharing, you know, everything that you're doing. It sounds like hearing from Martha that the restaurant workers would be actually next in line in testing. You mentioned something interesting about working with the state to get samples. Is there anything that our membership, Policy Circle people, could do to participate in any kind in a volunteering capacity in some of the testing effort? Or, you know, maybe you could direct people to what to look for on their state website to participate in that? I know that I was thinking that communities could actually take on testing so that we could get as much tested as we can. So maybe you could direct people to what they can do.
Yeah, you know, I think that at this point in time, continuing to raise the awareness of the need is critically important. You know, the state is working with all the hospital groups right now in understanding how they can best support the testing needs of the hospitals relative to the priorities that they've set that are really driven by our national priorities: healthcare workers, physicians, inpatients as well. And then looking to see how they can help support efforts to expand that testing through paradigms like Lilly has been piloting and trying to scale up. I think just contributing to that effort and helping to understand what the need is broadly, I think will be key to success in being able to expand it to all the individuals who need it, all the communities that need it as quickly as possible.
Thank you. Judy, do we have any additional questions at this time?
We have one question from Jamie Locke, and I think that should be our final one since we're a little bit over time. Jamie?
All right, thank you. I'll keep my video off because I have Corona hair where I haven't done it in days. But this question is for Rob. I've been kind of in communication with the Allen County Department of Health, and as you're talking about the testing that you are doing, is there a consistent testing measures that you are seeing? I know they send it to a private lab, and there's a lag from when that's reported to the state, and that whole process. Are you seeing a trend of the rates of severity and increasing, or is that lag? How does that all work when we're kind of looking at the severity of what Indiana's rate is right now?
Yes, so, you know, we've got a limited sample, and we're trying to provide as much of the information as we can to the state. And I know that the state, the commissioner's office and that have their epidemiology team looking at that. I apologize, I'm not sure if they've published any of that data yet or if they're still in the process of analyzing, but my recommendation would be to see what the state is planning to do and what they might be posting. I know that broadly across the state, the lag times with many of the testing facilities are long because of the demand. And that's one of the things that we're trying to manage as Lilly, to make sure that we can match our testing with our capacity so that we can support as quickly as possible turnaround times of results and getting those back to the states, because we know that they need this to understand the spread of the epidemic throughout our state.
Thank you very much. Thank you very much, Rob. Thank you all very much for participating. I think I'm going to turn it now over to Sylvie to give us a little closing remarks here.
Thank you so much. Thank you everyone for participating, and thank you Rob and Martha for sharing. The real numbers and examples, the impact on the restaurant industry, and Rob for the efforts in testing development. I think this was highly informative, and we will be publishing a summary of this conversation, as well as a resource page on that will include a guide on how do you write a letter to the editor to share your stories of impact and what you're doing to stop the spread and help your communities, as well as a template to contact your lawmaker or engage in the policy to tell your story. So look out for that. We'll be hosting another, what we call a Move the Needle conversation that will be open to the Policy Circle membership in its totality with Governor Pete Ricketts of Nebraska to discuss what leadership looks like on uncharted territory. And that will be next Tuesday at 12:30 Central Time. So, thank you. We invite you to send your stories, comments, questions to Mary Schaefer at communications@thepolicycircle.org. You can also post on our Facebook page. And of course, we invite you to host your own circle, virtual circle. You're seeing how easy it is to set up and run on Zoom. Having a topic of conversation and a brief makes the engagement so much more inspiring and brings hope and ignites leadership. So we really invite you to do that, and of course to support the Policy Circle as we bring this programming to you by going to our website. So thank you all. Thank you, Kathy and Rob, Martha, and everyone in Indiana for participating. And Katie, it was fun to see your baby, so congratulations.
It sure was. Vivian.
Bye, guys. You have a great rest of the day, and stay healthy and hang in there. So, goodbye, everybody.
Bye.